I had response elaboration training, or RET. This therapy technique encourages longer phrases and increased use of related words. It's beneficial for improving conversation and word recall for individuals with expressive aphasia. The goal is to increase verbal elaboration abilities. RET can be used with structured activities like picture cards or just during typical conversation. This therapy technique does not focus on right answers. Instead, the focus is for the individual with aphasia to produce their own responses. So instead of directly correcting a client, the clinician would use conversational modeling to provide more natural feedback. Forward chaining technique is also used, which requires the clinician to respond to any production the client makes. The communication partner is responsible for helping to shape the individual with aphasia's response. So the steps for RET. You show the image, you ask for a response, confirm and encourage, model a more complex response, ask a WH question to help the patient expand, repeat expansions until you've achieved the desired utterance, and encourage the client to repeat the full statement. This example of RET came from Kearns and Scher with an individual with Broca's aphasia. So to begin, the clinician presents an image of a man sweeping with a broom. The clinician prompts a response from the individual. The patient said, "Man sweeping." After this response, the clinician provides verbal reinforcement by saying, "Great," and then models a fuller response with, "The man is sweeping." The clinician then uses a WH question to encourage the patient to elaborate. In this example, that is, "Why is he sweeping?" To which the patient responded, "Wife mad." Again, the clinician reinforces by saying, "Way to go," then models a combination of the first and second response by saying, "The man is sweeping the floor because his wife is mad." The clinician models the full sentence a second time and asks the patient to try to repeat. The goal is not for the sentence to be perfect, but instead for the answer to have more content words than the initial response. For RET, you will want to collect pictures that show an action. Simple drawings are preferred because it allows the person with aphasia more flexibility in their response. You'll want paper to record notes, and it may be helpful to also have a recording device to help with monitoring progress. This is an example of a data collection sheet that can be used to keep track of responses when using RET. For evidence, in 1989, Kearns and Scher implemented RET with 3 individuals with aphasia. RG, who had conduction aphasia, was able to increase from 3 content words to 6 per utterance after about 20 sessions. JM had anomic aphasia and improved from 4 content words per response to 12. RW had Broca's aphasia and increased his content words from 3 to 9 per utterance. In 2019, Bunker, Nestler, and Wambaugh analyzed 9 studies involving 26 participants with aphasia who received RET or MRET, which is Modified Response Elaboration Training, which extends to procedural discourse and personal recounts. They found that nearly all participants demonstrated improvement in content production and generalization effects. In 2001, Wambaugh, Martinez, and Alegre studied 2 apraxic aphasic speakers involved with MRET. The 2 participants made gains primarily through increased production of nouns, which were used more frequently by both patients prior to treatment. However, one of the participants demonstrated improvement in other lexical types, including verbs and articles. Individuals typically experience improved content production when participating in both RET and MRET. Patient-initiated productions guide the conversation instead of targets selected by clinicians. Stimulus generalization effect is the use of trained behaviors in untrained context. Individuals are typically presented with the same images during RET therapy sessions, but many individuals with aphasia saw improved content production for pictures not used during treatment as well. This method is flexible and could be adapted to suit the needs of many. RET has typically been used with individuals with non-fluent aphasia, but has been shown to be effective with individuals with fluent aphasia. Visual impairments may need to be considered for typical picture activities. It's important to make sure the image is large enough and is placed in the visual field of the person with aphasia. Data available for RET is fairly limited due to small sample sizes, lack of randomization, and control groups. It's also important to make sure that images selected for therapy are culturally appropriate.